Hi, I am Leah Olson, Dr. Leah Olson, and I will be your nursing care management clinical instructor for this practicum type course. I met with the other two groups that I will be overseeing yesterday, but I didn't find out till yesterday evening that I would be overseeing you all, so I wanted to make this quick video for you so we don't have to try to find a time to meet. I wanted to really highly encourage you to go into the theory course and look at the EOP resources. There's like a 4-minute video that is there to help you study for the end of program exam on Monday. So as you'll see, the course opens tomorrow and we have some housekeeping. My dogs are playing right now and they might bark, and I'm sorry. Okay. We have some housekeeping items. These are things that you've done in theory or should have in theory. Obviously, the syllabus signature page from this course that need to be uploaded, and I'll show you those documents in those drop boxes as well. Okay, so we're going to go into the course right now. Here, of course, is the syllabus. The signature page is at the end, and I need you to sign that and upload it. Here again are those videos, and that's the quiz. We have to do all that for this course. Here's some information about COVID. And then here's some forms, those forms that we talked about that need to be signed and put in the Dropbox. So here they are. Here's the 2 forms, and here's the Dropbox for that you need to do. Oh, here's this will be my information. I will switch this out for you. But here's Dr. Lindermeyer's information. Oh, mine is up there. Look at that, as well as mine. So here's my email address. Here's my cell phone in case you need it. All right, so I'm available to you and your preceptor while you are at clinical. The PowerPoint, you know what, I think we're going to go over that now. So let's see. You can see anything that's in that square, it tells me. Actually, I'm going to, so you can see it all. I'm going to do it this way. So here, our dates for nursing care management are the 9th through the 8th. And if you didn't perform greater than or equal to a level 2 on leadership, adult med-surg, or pharm, you are required to submit completed remediation to the Dropbox by November 5th. So if you had level 2 or above, you don't have to. But if you didn't, you have to put your remediation in there. The end of program is obviously Monday, November 8th from 9 to 12. And then at 2 p.m., if you need to repeat EOP, you need to be on the Zoom call. And that date will be the 6th. However, this group, we have orientation at Encompass Monday afternoon at 1 o'clock. So if any of you need to repeat, you need to let me know so I can let Dr. Lindmeyer know. So we can make sure that you get the information you need regarding the predictor on the 6th. But we're going to go with it as everyone is going to pass the first time. Your Castle branch has to be updated. I showed you that. Here's some expectations, the clinical expectations. I'll show you where those are. All right, so it's a 135-hour course. So you have COVID training that's due the 8th. That's by Monday. That's in our course. And then you have to do 10 days at 12 hours or 15 days at 8 hours. There's a teaching project. I'm not sure that that's been uploaded, but you'll see more about that upcoming if it's not in the course yet. The end of the program practice A and B is due Monday. There is no remediation due. This is to help you prep for the end of program exam. Information about what to do in this is in the EOP video Dr. Lindmeyer gave you. You have a 1-day ATI online day, and that's your 135 hours. Okay, this is a pass-fail course. You'll do the online ATI day on your own time. The Teaching Service Project will look at the guidelines if they're there. If they're not, once I get them, I'll put that in the course for you. I need to approve your topic, and you can work in groups if you want. You don't have to, but you're going to record that and post it into the course. So here's this is me. I'm going to be talking with you. I'm going to be talking with your preceptor. I am going to be available to you every day. I'm going to establish some meetings with your preceptor and with yourself. I'll be talking with your preceptor about some strengths and weaknesses that you might have. Okay, I'm going to participate in your evaluation. Your preceptor's involved in your evaluation as well. All right, you're going to function as the primary care nurse. You're going to give reports. You're going to make assessments, ongoing notes. You're going to take care of the patient. You're going to deliver meds, manage IVs, follow through on the physician's orders. Okay, you're going to be that nurse. And here's a video if you want to watch about SBAR. And then there's some focus sheets to help, or brain sheets as they're sometimes called, to help you keep track of your patients and what you need to do. And we will take a look at those. And we will be evaluating you. Here's the clinical performance criteria of which you'll be evaluated on: delegation, continuity of care, evaluation, make sure you use the policies and the procedures. I want you to be open to communication and build some positive relationships. I want you to collaborate, all right? And you want to use that preceptor as a resource. So ask questions, know your resources, be gracious. We are visitors in their facility, okay? And this must be a plea to get you to fill out the survey at the end, and then know that pinning is on December 9th, okay? Now I'm going to go to the course and show you some. So we went through the orientation PowerPoint. Here's some required documents for you. Your Castle Branch Dropbox is here, the transcript, not the whole thing, the one that says compliant, kind of like you did for theory. We're not going to Baycare, so this doesn't apply to us, but this does. So here are the clinical expectations, and here's the Dropbox, and I need you to put that in there by the 5th. All right. Okay. Now this is what you're going to take along with you. You need 2 copies of this. You need to have 2 copies. One will be yours and one will be for your preceptor. You need to put one of these in a folder to give to your preceptor. And this, it's really important that you read this, because this is what you'll be talking with your preceptor about. So please make sure you take the time before you begin, and here's your checklist of different things that you need to be doing while you're there. Okay, so it's a short little document. Be sure that you read through it and that you have a copy for your preceptor as well, because they'll need to use this evaluation. So there's a summative evaluation: met, not observed, okay? And there's a formative and a summative. So you're going to do this twice with your preceptor. Okay, strengths, areas of improvement, recommendations. All right, so you're going to sign it with them. All right, so this is really important. 2 copies, you give them one in a folder on the first day that you are working with them. Here's if you have to submit any remediation from theory, they go here. ATI. So this comprehensive is due by the 7th. And that is covered in the EOP video that is in your theory course. And your results need to be dropped here on the 8th. I think you take it on the 8th or something like that. And then your final ATI transcript will go here. So there is the ATI assignment. Remember, you get 8 hours to do that. And here's your online assignment and on your own time drop boxes. This is an all-day activity. So here's the number of questions, here's the ID, and here's the password. We're doing this because you're going to be taking NCLEX, so we want you to continue in the habit of answering questions. So when you sit for the NCLEX, you are ready. Here is some information about the teaching project. We'll come back to this. I'll have something set up for you next week. You can certainly feel free to read it. And if you have any questions, ask me about it. Here's the COVID training that was mentioned, okay, that you need to work on. And there's the Dropbox for the COVID training. And then I think this is, yeah, this is the same. That there's the Dropbox. I believe I showed you that already. And here is some examples of report sheets for you. All right, you can look at these and decide which one of these you would like to use. But you need some sort of brain sheet. And then here is information about NCLEX for you. I'm not an NCLEX guru. I just know it costs money. So if you're looking for something to ask for Christmas, this might be it. And then here are some handouts for you regarding the EOP if you'd like to use them this weekend. All right. If you have any questions, you can certainly email me, or you have my phone number there. All right, thanks a lot. I know this was brief. I just wanted to give you guys something before it opened tomorrow. And like I said, I didn't know you were part of my team until yesterday. Thanks so much.